Good morning, respected judges and dear friends. My topic for today is social media, a double-edged sword in the hands of a clinical practitioner. I have no financial disclosures. So over a century ago, Sir William Osler from Canada had referred to doctors as a great army of quiet workers who offer consolation in sorrow, need, and sickness, but not anymore because of social media. This encompasses web-based applications that enable users to create and share content on blogs or web pages, social networking sites like Facebook and Twitter, professional networking sites like LinkedIn, and content communities like YouTube. The Indian imprint here is very huge because India is the largest consumer of cell phones, two-thirds of whom use mobile internet, and 67% of these urban internet users use social media. So if we do the math, India has over 60.5 million social media users, and yes, it has been found that social media definitely determines their choice of caretaker. So social media is here to stay. So what is the benefit for a clinician who is social media active? Because it helps us to engage with our target audience by putting across credible information and allay myths like vaccines causing autism. It helps us to remove taboo regarding illnesses like psychiatric illnesses, which patients may be more comfortable discussing online. Staying updated in real times by education online through emails, messages, videos, professional networking, and last but not the least, marketing, which is definitely not unsavory nowadays. So have you ever Googled yourself and felt comfortable about what you see? And why must we control our social media image? Because it's like a digital footprint. It stays there forever. So it makes more sense that we have control over it, and we can do that by having separate personal and professional social media pages and thinking before we post anything online. Because even the most anonymous content can be traced back to its point of origin at any point of time. So it never really disappears. We must begin by using platforms which are more comfortable to us, like WhatsApp. We must polish our social media channels by putting our full name and bio, and we can do that by having our own website or a blog, so that whenever somebody Googles us, our own website or our choice of content comes up instead of third-party rating websites like Just Dial or Practo, on which we do not have complete control. We can also book our URL for doing the same, that is for doing something called as search engine optimization, which I just mentioned. It determines, we can determine what comes up when somebody Googles our name. We must regularly update our social media channels and make clear that you speak only on behalf of yourself and not your employer. Do not ever give medical advice in a public forum, and of course, expect criticism from colleagues and patients. A digital team over here can professionally help you to do not only that, but also helps you to get access to TV houses or newsrooms so that you reach a larger audience, helps you to get enough likes and followers on your social media professional page, publicize any campaign that you may be running in the community, and traction businesses through LinkedIn. How do doctors preserve their personal image? Number one rule would be to avoid inflammatory contents. There have been instances where doctors have been suspended mainly because of their online content, and on the extreme case we have the example last year where a gynecology resident succumbed and gave up her life because of constant online bickering and bullying. So we never know what our comments lead to. Also clarify the availability to your patients, how much you would allow them to encroach your personal space by adjusting your privacy settings, and you can use a pseudonym to avoid traffic, and of course, check with your employer's social media guidelines. Your online professional image is also to be taken care of. For that, be truthful, respect patients' confidentiality, be clear about expectations, do not promise out-of-the-box results. For that, you can get a good counsel who can tell you about the medico-legal aspects of online marketing. Declare any conflict of interest. There are many important guidelines laid down by the American Medical Association, British Medical Association, and also the Government of India, Ministry of Health is also in the process of getting guidelines for Indian doctors and social media as well. One of the interesting things I came up with was the elevator test, where the Mayo Clinic tells their doctors that if you are not comfortable sharing any data or discussing something about a patient in an elevator with your staff or your colleagues, then do not post it online. And always keep in mind how you appear to your patient whom you care for. Today, there's also this temptation of online consultations. It can be an advantage because it helps us to deliver healthcare in remote areas, especially through telemedicine and mobile health. But it also poses ethical dilemmas because a patient needs to be examined physically before we give any medication. A case in point was something which happened in 2018 where a gynecology couple was booked under section 304 of IPC for culpable homicide not amounting to murder, where there was a post-cesarean patient who was discharged from the hospital and developed discomfort at home. Instead of re-examining her, they kept on giving her medication consultations over the phone, and ultimately the patient succumbed. In fact, there are certain medical councils who have warned doctors against online consultations. So to conclude, once you post on social media, remember it's written in ink. So use this digital footprint to your advantage. Check what comes up by Googling yourself at least once a week and avoid controversies. So social media to friend or not, of course, become your social media friend, but make it your friend with benefits. Thank you so much.
Thank you, doctor, for excellent presentation. One point to be noted is online consultation should be totally banned. In Europe and America, it is totally banned now. It is creating more problem for the doctor as well as patient also.
Definitely, sir. I totally agree with that.
This is a message from your paper.
Very good presentation.
Thank you, sir.
But we were expecting some examples from eye care actually, and especially related to recent episodes of ophthalmitis. That is a concern for probably all the ophthalmologists as far as social media is concerned. So that part I find missing in your presentation.
Right, sir. Right.
Thank you.
Thank you, sir.